Have you ever had relentless nausea was my tickler. Now I mean no, I mean so persistent that you think you'll go insane. How about a nagging cough that persists? If you know what I mean, and even if you don't, join me this Monday night as we continue our voyage through my materia medica and the remedy. Those of you who have my materia medica and are kind of following, we are in the eyes, the letter I. So you probably already know, for anyone who's done any small amount of studying of homeopathy, it's Ipecac, Ipecacana. So it's Ipecacuana, excuse me, I've mispronounced it, Ipecacuana, but Ipecac for short. And Ipecac, if you're a nurse or you're older, a grandma, maybe you remember that there was a time when Ipecac, syrup of Ipecac, was in every medicine cabinet. And it was used to cause vomiting. So when a child, I would assume, drank, say, Clorox or something, they would throw this Ipecac of syrup of Ipecac down the child's mouth, and it would cause vomiting, and the poison would come up. So it was used in emergency rooms. So now you're thinking this is in the gross form, right? The gross form is what was caused in the gross form will be eliminated, uprooted, corrected in the homeopathic form. If you remember that, that will all make sense to you for those of you who are new. So what Ipecac does in the gross form is causes vomiting. So when we're using it homeopathically, say in a 30th potency, 30C or 30X, it will abort the vomiting. But not just vomiting. It also aborts nausea. Nausea that is pretty extreme. It's the kind of nausea that can be when a woman is pregnant. It can be for the first trimester. It can be the kind of nausea that we don't know what the etiology is. We don't know the cause. So we're going to consider that. Look, if it's just a little nausea and it's time to vomit, then just do it and don't worry about it. Get it out of your stomach, and no need to use homeopathy, because I don't like to jump too quickly on homeopathic medicines when it's unnecessary. Instead, I would rather see you use these medicines judiciously. But if it's someone in your family is vomiting or they're nauseous and it's just this is going on too long, by all means, you're going to use Ipecac 30. How frequently, you ask? Actually, I haven't seen you ask that, but I know you're going to. All righty. You're going to use it as often as needed. So how do we start that? What does that mean? Well, you give one dose, and one dose might do it. Sometimes it doesn't, so we use a second dose. How long do we wait? If the vomiting is absolutely excruciatingly relentless, then by all means, you're going to use it in 15 minutes. Don't wait. Don't wait 3 hours. Don't wait 4 hours. Don't wait 6 hours. You're going to give it in 15 minutes. So every 15 minutes, maybe for the first hour, we're going to give it every 15 minutes. But by that time, generally speaking, we see it abating, and the person falls into sleep and is relieved. Interesting. Oh, Kathy Diaz says, yes, the CDC needs to admit that it's not a pandemic. I'm really kind of surprised this is happening. Excuse me for reverting back again, but I'm surprised this is happening because, to be honest, ever since I started studying homeopathy some 33 years ago, I've learned not to trust the CDC. I don't trust them. I think there's a lot of corruption. Not everyone, certainly, but there's a lot of corruption that goes on in there, and it's not just a fanciful idea. I've done a lot of reading, and these organizations are too, what's the word? Big, too lumbering, too entrenched, too old. Too many people established in great positions with very, very high incomes. So it's easy. Well, let's put it this way. It's hard to find scientists who's not in a pocket of one of these kinds of organizations. So it's a very, I mean, I don't know about these statistics. I don't know what I trust anymore, and I'm sure you all agree with me. As Mark Twain once said, and I don't know if I said this last week, I've been using this lately a lot. Mark Twain said, there are lies, there are damned lies, and there are statistics. So if that isn't the truth, and he saw that 100 years ago, was it 100? Yeah, about 100 years ago, There's no doubt about it. Statistics are one of the great tools of lies. So check it out. Who knows what's going to come of this? I don't understand. Because they also told us masks have no value, or very little value, excuse me. 3 days ago, in the Wall Street Journal, it was said that the CDC said masks have very little value, if at all. What do you know? What do you know? I've been thinking that for a long time. Alrighty, let's go to Ipecac, okay? The keynote is vomiting, gagging, breathlessness, and coughing. All of those. Not that you have all of them simultaneously. They're just all there. You can use it for gagging. You can use it for vomiting. You can use it for breathlessness. And you can use it for coughing. If you happen to have all of them, that's great too. But there's one other thing. Does anyone know the other condition that Ipecac is really great for? I'm going to scroll down. I'll go back up later on. Let's see if you know the other big condition. Okay, so I'm going to read from my materia medica. Thank you for the compliment that you like my materia medica. Yes. Alrighty, so there was a time when most households had a small bottle of Ipecac in the medicine cabinet in case a child swallowed lye or another poison, especially lye because in those days they made soap. The parent knew to give the child this allopathic treatment, so it was gross, to cause instant vomiting. Made into homeopathic formula, it is used for what it causes. Hence, for relentless vomiting or nausea, Ipecac 30 is one of the top remedies to consider. Now, I said top, and I want to stress that because I think it's important that you understand that just because this is the medicine I'm teaching you for this doesn't mean it's the only one. Because if Ipecac doesn't work, then by all means, Diane Allen, you got it. Hemorrhages. You bet it. You bet, Jen. Yep. Internal hemorrhage. Well, also asthma. Yes, Pat, thank you. Bleeding. Yes, absolutely. Asthma. Yes, breathing, breathlessness. But I was thinking of bleeding because I'd already talked about breathlessness, and breathlessness, of course, is asthma. Internal hemorrhage, says Jen. Nagging cough. You bet. We got it. You've got it, folks. All right. So Ipecac is primarily used for relentless vomiting, nausea, vomiting, and pain. It is also used as an emergency remedy to stop bleeding. So this is, now I've used this for women with very heavy menses, and it has acted. It's not my first choice, but it is one of the choices I definitely consider. But in an emergency, it can be really valuable. Now, there are two other medicines that we think of. There are many others, but two others that we think of when we think of bleeding, hemorrhaging, and that is usually arnica, right? Don't we think of arnica? And phosphorus. But if you've got your materia medica, then you're going to read those and make sure that that fits best. Which one fits best in this situation? If you don't know, and a lot of people say, well, I don't know, I can't tell. I get that. I totally get it. So then you just say, okay, I'm just going to go with the first one. I'm just going to decide, and I'm just going to go with it. And you use it for, let's say it's for that bleeding, and you're going to use it in a 30th potency. I've also used it in a 200 potency, Ipecac 200, every 15 minutes for hemorrhaging. And then if it doesn't, we don't see it, we're still going to see bleeding. Sometimes we see it just slowing down. Sometimes we see a complete abortion of it. Absolutely. It's just ended. All right. And then, of course, there's hamamelis, which is also great for bleeding. Okay. This remedy, I'm going to read back to my materia medica again, is especially indicated in overweight children. Now, I'm reading this to you for a specific reason, okay? And adults who are feeble and catch colds in relaxing atmospheres. The person may be irritable, holds everything in contempt, and is full of desires, but cannot identify what those desires actually are. What I'm telling you here is, this is classical. And I often put a little bit of classical in my materia medica because I think it's important that you understand that there is a little bit of a bridge between classical and practical homeopathy, between classical and using protocols, Banerjee protocols, or whatever protocols you might be using. And we would call this part of the mentals. But what I have found through the years is that unless the physical is, if the physical is clear and you've got an absolute hierarchy, there is bleeding and it's an acute situation, or there is vomiting. There could be vomiting and bleeding. Now, I'm not talking about a little bit of blood. If someone's vomiting, you see a little streak of blood. That's not what we're talking about. We're talking about hemorrhage, lots and lots of blood. I've used phosphorus right after having a baby, and it works so well for bleeding. You bet. Phosphorus is very good after births. So is arnica, and so is pulsatilla. 3 good remedies for hemorrhaging after birthing. So I included this in there, these mentals, because I want you to always be kind of bridging a little bit of classical, so you understand what the classicals are talking about. And classicals, classical homeopaths can do very good work if they are highly experienced. I can't emphasize that enough. Classicals must be extremely experienced. It takes a very long time to get the hang of classical. So make sure if you see a classical homeopath, make sure he or she's got gray hair and sees many patients full time for many years, over many years. I'm talking 20 years. Patients every day. The whole schedule's filled. That's the kind of homeopath you want if you're going to use someone classical. Okay, so symptoms are worse from movement. Now, that doesn't always have to show, but if someone is vomiting or they're nauseous, they just move their head a little bit and it brings on the nausea or vomiting even more so. If the person is bleeding, they move a little bit and it makes the bleeding even more prolific. The worst from summer heat, could come on around summer heat, or a moist, warm wind, and when lying down. Interestingly, you would think that you would want to lie down if you were hemorrhaging, but it makes the person worse. And the person also may lack any thirst, which is kind of not so interesting with vomiting and nausea, because who wants to drink anything when you're nauseous or vomiting? But certainly when the person is hemorrhaging, water would be a very good thing, especially water with some salt in it. So I also wrote, my training with Dr. Pradeep Banerjee has taught me to use Ipecac during coughing fits. So when you think of gagging, which is what this what Ipecac would do, it makes you gag in the gross form. So gagging, a gagging cough, or we can even extrapolate that a little bit because we have the clinical evidence of it, that the cough is so extreme, whether the person gags or not, it's just an extreme cough. We're not talking about the kind of cough that is a bark like croup. We're talking about cough, 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 lots and lots of coughing. When the coughing is, here's our word, I used it earlier for the nausea, is relentless. A relentless cough, okay? Not a deep, lung wrenching, although it could be that too, but more often it's just, they can't stop. They just can't stop. All righty. Yeah, Tanya says, I loved reading Dorothy Shepard's classical homeopathic memoirs. I love Dorothy Shepard too, but to be honest, I really don't consider her classical. If you read her stuff, she was one, boom, 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 one case after another in the emergency room. She counted a little bit on classical, but mostly she was using the key note of the person, the keynote of the remedy, and that's how she came up with it. Every once in a while she'd talk about classical. All righty, let's see what else we've got here. Ipecac 30, excellent for asthma. Somebody said it earlier. You bet. For asthma during the asthmatic event. Some people, and this is what I learned in India, you can use it instead of an inhaler. Now, I'm not going to tell someone, don't take your inhaler. Please don't get me wrong. I don't want to be pulled off for that reason too, but I'm not going to tell you don't take your inhaler. But if you feel it coming on and you're thinking, I don't know, should I use the inhaler? I've not used the inhaler in this situation before. Maybe I should just try Ipecac. And it's in a 30th potency, and it's used every few minutes. Every few minutes. Is this the right link? It is. Thank you. Yes, that is, Natalie. That's the correct link. Interesting. You're going to have to study it a little bit. It's a little hard to kind of get. You want to read the key and really get it in it before you make a decision on whether or not you understand it completely. Okay, would this be a good option for vertigo when one feels dizzy when moving or walking? Walking. This is not a vertigo remedy. This is a coughing, vomiting, gagging, breathless, and bleeding remedy. It's not for that. I'm reading, let's see, I'm going to go back up again. So every 15 minutes for coughing. You know what? If it's really severe and the person can't catch their breath, I would do it even more frequently. But if it's not that severe, then every 15 minutes would be very good. I am reading The Science of Homeopathy. Fascinating. You know the best part of The Science of Homeopathy by George Fathulkas is the back, where the graphs. Of everything that he's saying, that's the most important. That's the most practical aspect of that whole book. Okay, I have a fiance, blood clots. I looked up your blog, and luckily I had some homeopathic medicine in my kit on vacation, and what I used was Article 200 with phosphorus 200, and we were able to stop it as suddenly as it came on. This is for her fiance who had hemorrhaging from colorectal cancer with blood clots. Nice job, Amy. Nice job. If that doesn't turn your fiance's head and everyone around you's head around. Now, well, it's not going to turn the doctors' heads around. It's not because they're bad people. It's because they've just been trained not to think that way. Would this help someone with cystic fibrosis? It could help with the coughing with cystic fibrosis. Yes, when the coughing is relentless, and that is cystic fibrosis, yes. Whooping cough, I have used it for whooping cough. Yes, I have used it for that. It's not my first choice, but definitely keep it in your hip pocket for that. Okay, let's see. I like that you put a bit of classical in your materia medica. Massimund panos. Yep, you bet. Phosphorus in what potency? Well, you can use phosphorus in a 30 or 200. Most of these remedies are in 30s or 200s. Just know that in general. Is it for bleeding in specific organs? The Banerjee book does not use Ipecac for gastrointestinal bleeding. They do not. They do not. I would use it for when it's hemorrhaging. Not for just bleeding, hemorrhaging. You want to correct that gastrointestinal problem in the stomach. There's no doubt about it, or wherever it might be. It's usually in the stomach. You want to make that correction. You can still use it if you had to, well, kind of as an SOS. How would you describe a nagging cough? Does it have to be a hard no? Or ongoing, light? Ongoing. Just relentless. Remember the word relentless. Think of it that way. Okay, that'll help you. I've used phosphorus right after having a baby. You said I read that already. How do I view? Please, if you don't have Facebook app, thanks. I'm sorry, I don't know the answer to that. Maybe Natalie can answer that. Wow, I would have. I have von Willebrand's disease. I wonder if it would work. There are better ones for von Willebrand's, and I don't want to get into that, but it could potentially be used. Yes, if lye is swallowed, you use butter. I never heard that. Interesting. I don't know anybody who makes soap with lye anymore. I mean, I shouldn't say that. I do know 2 people who do that. Nagging cough, bleeding. Yes, you got it. Okay, those were all the answers to my question. Now that folks are walking around with staph infections on their face from wearing them, you bet. You bet. It was the stupidest thing I've ever seen. I've been in agreement with you, Joette, since it started. Thank you, Marla. Yeah, I know. It's nuts what we've been put through. And it's, okay, I agree, Joette. Robert F. Kennedy Jr. Okay, you think I'm political? He's on the other side. Well, I don't call him on the left. I would call him, he's a Democrat. He's a conservative Democrat. He's the way the Democrats used to be when I was growing up in the 60s. Robert Kennedy Jr., the best. Follow him and donate to his organizations. The best. Okay. Yes, the CDC, I've read that. The CDC owns the patent for COVID. That's why I'm wondering what's going on. I'm not sure I understand this. It's not just the CDC. There are specific names that I'm not going to mention now. But it wouldn't be hard to figure out. All righty, folks. I think we've got it. It's 8:33 Eastern Standard Time. I'll see you next week. Looking forward to it. God bless all of you. And I love seeing you all here. Thank God for all of you and homeopathy. Mwah! Love you all. Take care, folks. See you next week.